Welcome back to another episode on the Healing Wellness Show. I'm Dr. Karim, your host, and today we're going to be talking about an incredibly important and sometimes overlooked topic, and that's chiropractic care for kids. Today I've got Dr. Sharp here with me. She's an expert in pediatric chiropractic care at Family and Sport Chiropractic. But we're going to be exploring how chiropractic care supports healthy development in children from infancy to adolescence, and how early care can promote lifelong wellness. So Dr. Sharp, welcome back to the show. Why don't you introduce yourself to the listeners that haven't seen your other episodes and kind of tell them a little bit about yourself.
Hey, everybody. I am Dr. Sharp with Family and Sport Chiropractic. I joined this clinic early December of this past year, and I am loving it. Oh, 5 months. Sorry. I did that.
Start again.
Okay. So, hey, everybody. I am Dr. Sharp with Family and Sport Chiropractic. I just started with this clinic in December, and I absolutely love it here. I've been a practicing chiropractor since 2016, graduated from the first ever chiropractic institution, Palmer College of Chiropractic in Davenport, Iowa. Yeah, and I'm so happy to be here today.
Well, thank you. All right, Dr. Sharp. So we're just going to ask you same thing like last time, questions that our viewers will post, or just questions I'll ask you, and kind of go from there and have fun. All right. So why don't you tell us and start from the beginning, why do children need chiropractic care? Because a lot of parents don't think that they need it, or a lot of people don't know why they need it. So why do children need chiropractic care?
Yeah, that's such a great question. Children, they go through rapid changes from the time that they're little. As they're growing, their spines, their ligaments, their joints, their muscles, they develop more. Chiropractic care focuses on keeping the spine in alignment. So really, if you start out bringing your children to a chiropractor, we can really properly monitor the development of the spine.
And that's because of like all the falls and accidents of the kids because they're clumsy.
Yes.
So, okay.
Yeah.
Okay. What about, you also hear about newborn babies getting chiropractic care. Why would a newborn get chiropractic?
Yeah, that's such a great question too. In our office, we've seen parents bring their children in for just having colic, essentially. Colic is something that's been so prevalent, but there's not really a direct cause for it. It's really just due to excessive crying because something's going wrong. That is connected to the nervous system. So if there is something out of alignment in the spine, we can try to find that misalignment wherever that nerve interference is happening and try to give the proper adjustments to remove that interference so everything can work correctly. And usually with newborns, their digestive system and their nervous system is underdeveloped, so they're more sensitive to gastrointestinal issues. And so again, trying to figure out where that nerve interference and correcting that can help decrease the discomfort, the bloating, and that can help with the crying. So there's tons of different things that can cause that, but that's something prevalent that we see a lot. And then there's that correlation between those two.
And what would cause like a baby be colic or have ear infections, or what's the cause of that? Like, you usually say, for an adult, they'll come in, it's like, hey doc, I threw my back out and it's because I was doing the lawn. Right. What would cause a newborn baby that hasn't done anything, hasn't moved yet, to cause that stress on their system?
Yeah, I mean, the birthing process can be something that can cause some of these issues. Just the stress and strain that the baby goes through can essentially create a lot of tension in the muscles in the neck and the upper back, and not relaxation of those areas. And then those muscles can get tightened up, the ligaments and everything can play a part all together. That can really affect the spine and lead to those cervical misalignments, sick misalignments of the spine. So if we can figure out where those misalignments are occurring, we can help restore mobility and everything can work together how it should. There's that mind-body connection where the brain is connected to the spinal cord. So if there is something that's out of whack, all of our nerves innervate and control different parts of the body. So with the colic, maybe addressing the neck specifically or the upper back can help to alleviate those symptoms.
So what are some of like the common issues that you see in pediatric patients?
Yeah, so colic would be a popular one. Colic, scoliosis. In children, we've seen like strains, sprains, shin splints. We've seen, did I say scoliosis already? Scoliosis. It's a popular one.
It is a popular
headaches, migraines, you name it, latching issues, way more stuff that maybe everybody's not necessarily aware of.
So how does chiropractic care help with issues like you mentioned, like colic or ear infection or latching issues for new?
So I know we talked a little bit about the colic and how our nervous system as newborns and our digestive system is underdeveloped. So we become more sensitive to these issues. Kind of a similar scenario with the acid reflux and with the ear infections. A lot of kiddos deal with ear infections, and that's something we've seen a lot as well come through our office. I always tell parents that it could be attributed to a couple different things, but as far as our wheelhouse and what we can address, if there are neck misalignments occurring where really focusing on the upper neck, that atlas bone, sometimes it can get misaligned and it can put pressure on the eustachian tube. It's so close to that area. So when it does that, it can allow for proper fluid drainage. So if we can figure out where that misalignment is occurring and address that, it can allow to take pressure off that area and allow for proper fluid drainage. So that is something we see a lot as well.
Well, thanks. Thanks for sharing that. What are some of the differences between adjusting a newborn baby to a child to an adult?
Yeah, it's so different. I love that question because a lot of people, when I tell them that children can get adjusted to, they're kind of in awe and wonder, well, I'm getting adjusted this way. How in the world are you adjusting a baby? And definitely the amount of pressure is different. It's a lot less low force. I read something the other day that I thought was a really good analogy. It's kind of like if you were to squeeze a tomato and check the ripeness of that, that's about the amount of pressure you're using when you're adjusting a newborn or a baby, or like a baby, it's a lot more gentle pressure. Maybe the techniques are a little bit different.
So you're using like you mentioned, like squeezing a tomato, are you using just fingers? Or?
Yeah. So really with babies, you can use your fingers. Most of the time when I've adjusted a child or baby, I've used my index fingers just to kind of feel for the motion. It's not like an adult adjustment where we're going to go through the whole line of drive and give the amount of force that we would with an adult. It's a lot less. Sometimes it's really just even just putting a little bit of pressure with our fingers and allowing just feeling the muscles release, the tension release. And then also too, like the technique, sometimes we could use an activator, which is another type of tool in our back pocket, so to speak, that we can use with the baby. And then as a baby transitions into a child, we can apply a little bit more force, maybe do a little bit different style of adjustments with them because they're so flexible. Maybe we do some side posture with the child because if we were to lay them on their stomach, they might just, their back and everything is so pliable that they would just keep going and going and going, and there wouldn't be as much resistance with that adjustment. And then when we get to an adult, the adjustments are more force. We can be way more aggressive because there's the bones, the muscles, the ligaments, and everything are fully developed at that point.
So would you say it's safer to adjust a child than an adult?
I would say it's even game. It's just as safe to adjust a child as it is an adult. Just the technique and force that we would use is a little bit different, but it's just as safe.
So what kind of training goes into being able to adjust, say, a newborn or a kid? Or is it the same training, or is there extra training that you have to do?
Yeah, that's such a great question. For me personally, I feel like clinical experience, just getting hands-on, more hands-on experience with babies, children, definitely plays a part in how you can further your skills and know how to adjust the child and make them feel comfortable and that they're in a safe environment. And then I will say, oh gosh, I lost my train of thought. I'm sorry. Okay, what was the question? Okay. So really having that clinical hands-on experience, being able to see as many babies, kids just get familiar with their spines, definitely can be a beneficial part to knowing how to adjust them and making them feel safe and comfortable. Also taking workshops, seminars, continuing education classes on pediatric chiropractic healthcare goes a long way to that as well. And then some people even will go into more specialized training for pediatric care and get a higher certification. So really any certified, skilled, qualified chiropractor can adjust kids, but you can go on and get further certification.
Well, thanks for clarifying that. Okay, so how do growth spurts and major development milestone affect the child's musculoskeletal system?
Yeah, so when a child is growing, it can cause a lot of pain and misalignments to occur, and that can honestly affect our posture, our balance, our coordination. So it's very, very beneficial for a child to come in here, especially when they're going through growth spurts, because we want to make sure that we keep the spine in alignment as much as possible.
So what are some of the signs that like a parent might notice, hey, my child's posture is off or the spine is under stress, or how can a parent see that in their kid?
Yeah, and it's hard to know that with a baby because a baby can't just flat out tell you, hey, I'm in pain, but you can really monitor signals that a baby would give, like, for example, the colic, maybe not having regular, and then transitioning into a child, maybe they are telling you, hey, like, I'm having some back discomfort, neck discomfort, seeing how their posture is. Are they hunched forward? Looking at their hips, is one hip higher than the other? Do they have anterior head carriage where they're jutting their neck forward? There's a multitude of things that we can do to address that.
So speaking about that, then it's the biggest topic that a lot of people are talking about nowadays is that text neck or tech neck, right? Or are you seeing then a lot of that in children right now? Because, I go out to restaurants and every kid and every table is doing this.
You are so right. I would definitely agree with that. I definitely think it's becoming more prevalent just with the way that the advancements have been with technology, with computers, cell phones. More people are getting into gaming online, you name it. And so over time, if we're doing that for long periods of time and not taking a break or knowing that we're doing that, it can really cause a lot of strain on the spine, especially the neck and the upper back.
So what kind of issues can a kid experience? Is it right there and then that they experience that, or is it later in life? And what are things that parents need to know?
So it really could stem from, honestly, when they're really little throughout their adulthood. So it's good to be aware of that and to take preventative measurements, come and get adjusted. Let us assess the spine and see what's going on. It's something where different things throughout your life, no matter what you're doing, if you're at school, sitting at a desk, carrying your backpack on your shoulders, all those different things can affect the spine in a negative way if we're not doing them appropriately. So becoming aware of those things too. Really talking to your children and seeing how their day's going, what they did.
So you just mentioned kids, backpacks, and sitting at desks. How does that affect their spine as well?
Yeah, so a lot of kids you see sometimes walking down the street when they get off the bus after school and they have a backpack over one shoulder. That really can cause a lot of asymmetry in the spine and create muscle tension in areas that eventually can cause misalignments. So try to be mindful of that. And a good way to fix this would be to wear both straps over those shoulders. Also, if your backpack is too heavy, sometimes that load, it can put a lot of stress on the low back because we tend to want to hunch forward to compensate for the amount of load in our backpack. So those would be two things as far as carrying a backpack. And then sitting at a desk at school, most of the time the desks are not very ergonomically friendly. After hours and hours of sitting at a desk, you're most likely hunched forward. Again, that puts a lot of stress on the spine. So maybe looking into more lumbar support would be beneficial in that case.
So what are some recommendations you would recommend to parents for encouraging healthy habits at home?
Yeah, that's such a great question too. Really trying to stay active, trying to find things to keep you moving. Also being mindful of screen time. Some people really, again, like to game and be on their laptop for hours and hours. So, which is not necessarily a bad thing if you like to game, but as far as the long periods of times, it's good to minimize that to a lesser time. So you're not just sitting there for hours and hours and creating a lot of muscle tension that will eventually build up and lead to those misalignments. And then also maybe stretching, trying to figure out again, analyzing your backpack, how much stuff you're putting in your backpack, what your posture looks like.
So are there any benefits to, parents bringing their children in for just regular chiropractic care without having any symptoms or any issues?
Yes, there definitely is. I tell even adults all the time that there's people that have just came into us to seek care and maybe they haven't really been having a lot of pain. So again, pain can be the last thing to show. So with kids, it's so great to come in to get checkups because again, as you're a newborn transitioning through childhood to adulthood, your spine is rapidly going through changes, you're growing, everything's developing. So again, that over time the bones can grow faster than the muscles and the muscles can get tight. And then again, that can create a lot of tension and create those misalignments to occur. So again, chiropractic care, we're all about maintaining proper alignment. And so it's so great to just bring your child in if you have questions about anything pertaining to your child, because it's great to educate yourself and ask questions.
Well, can you share some, let's say a couple success stories about chiropractic care in kids and how that's helped them out?
Yeah. So one of the youngest patient that I've ever adjusted was about 6 weeks old. That was about one of the first years into practicing. And I was really nervous because I'm like, oh my gosh, I, don't want to hurt this precious human being. And I'm like, I'm not going to. Just have confidence. You got this. And so I remembered I just killed it with confidence, so to speak, right? And started adjusting the 6-week-old. And the mom had said that she was dealing with colic. She was dealing with colic ever since she had been born. The mom said she wasn't really getting any sleep. The dad worked third shift. So it was really just her being there and helping out the child. And we adjusted her several times. And then it got to the point where she was starting to relax better. I noticed that there were some misalignments in her lower back. So adjusting that helped maybe alleviate some of that tension and pressure that was building up and triggering that colic. So that was a great success story. That patient, again, the baby couldn't tell me that she was in pain, but there are other signals that can tell us what's going on with the child and what we need to do to adjust them and get them optimally functioning as they should. So that was a great success story. I also remember adjusting a child that has dealt with attention deficit span, ADHD, where he had a lot of sensory processing and emotional regulatory issues. And after adjusting him a good handful of times, the mom had informed me that, wow, he's really more focused and paying attention for longer periods of time. So those are a couple good success stories.
Wow, those are amazing. Oh, thank you for sharing. Thank you. Well, can you tell us about the role of chiropractic care in chronic illnesses in children or ear infections is a huge one that you hear a lot.
Yeah, so chiropractic care, we really focus on the nervous system, or the spine and the brain is connected. So if something, again, is out of whack, it's not communicating the signals properly. So if something is misaligned in the spine, we want to figure out where that's occurring, address that, and try to fix that root cause of that issue. So in turn, that can help with our immune system. So it can help to overall boost our immune system, which can fight off illnesses, fight off infections, and so forth.
So what's your let's say your secret or your approach to dealing with children or working with children to build their trust, to trust you, to touch them? Because a lot of times children want to be next to their parents. They don't want to talk to strangers. So how do you build that trust?
So worry about that. First of all, we want to make sure that they're in a very safe and in friendly environment. So just making sure that the environment around them is calm, that everybody's friendly, talking to them in their language, how they would speak. Because sometimes as doctors, maybe we get so technical that we need to change our jargon that we use and talk in a more layman's term way. So that would be another approach. I remember adjusting a child that was kind of hesitant for a while. And then the more and more that his mom was getting adjusted as well. So he could see her get adjusted, and that helped him feel more relaxed because he knew hey, we're not harming her or helping her as much as we can. And then I also put a stuffed animal on a table and just pretended to go through and adjust him. And so I also had the same person go through and do that. And I think that helped him feel more relaxed as well. So that's another little extra approach that I've done, but also just being kind and friendly and being gentle and really explaining everything that we're doing, and make sure that sometimes the table can seem loud and that can off-put adjusted, especially if they're dealing with ADHD or if they're autistic. So making sure that they know, hey, this is not hurting you. You're just going to hear this loud sound. really just make sure that it's a safe and calming environment for them.
So how do you get the parent to, trust you, or how do you educate them on what you're doing?
Yeah. So when a parent comes in, usually we will ask them the history of the child if they're under a certain age and they can't necessarily share that information with us. And then really, I like to go through and explain what chiropractic care is. And if that parent comes in and their child has a specific complaint, we'll usually zone in on that complaint and really address that and explain how that can be impacted and how what could cause that and how chiropractic care could help that essentially.
So let's shift over to, we've been talking about infants. Let's kind of start going into, they start now being more active. Sports is a big deal in the United States, especially in childhood and families. So how can chiropractic care support young athletes?
Yeah, so a lot of athletes, I was an athlete myself, so I definitely can share some insight on what I've been through and how chiropractic care has helped. But athletes are prone to injuries. And so chiropractic care, if you start getting adjusted at a younger age, it really can be more about preventative care, preventing long-term injuries from occurring, trying to, get the muscles and ligaments and everything relaxed as much as possible. So over time, that can have less negative health effects on the body over time.
So nowadays there's, I remember back then sports, it was like you do it at high school or school, but now there's a lot of clubs, right? And, parents put their kids year round in sports. Do you see a lot of like overuse or injuries in kids now because of it?
Honestly, yes, because kids tend to get so focused on one sport and do that sport continuously. Most of the time, just like you said with a club sport, they're playing that year round. So they're prone to more injuries because they're not having that time to relax and recover all the muscles, ligaments, the joints, spine, maybe as much as they should be. So really trying to, if your kid's interested in doing a couple different sports, that might be honestly more beneficial in the long term for that person, because we have seen overuse injuries just from the repetitive movements of that certain activity that they're doing year round.
So what's your recommendation for that overactive,
Yeah, so again, that's such a great question. So being really preventative about care, going and getting adjusted, stretching before you work out, stretching after you work out, knowing the proper time frame to from that certain movement, maybe incorporating certain mobility exercises and strengthening techniques, especially to the core, which is such a huge muscle that can affect our whole body.
Do you work with other healthcare providers like, PT or just regular MDs to ensure like a well-rounded approach with what you're doing, especially with, infants or kids or adolescents?
Sorry. Yes. I think it's definitely crucial to work with other care providers because our focus is spinal alignment, making sure that everything's in alignment and that everybody's spines are developing properly. So other healthcare professionals maybe have more insight on rehabilitative measures or strengthening measures, you name it.
It's nice. So what's your advice to a parent that's unsure if their child needs chiropractic care or hesitant? Like, what would you say to them?
Yeah, I definitely can understand that hesitancy. I think it's something where some people just aren't aware of chiropractic care and all the things that it can help with. So I definitely recommend going in, having that consult, getting to talk with the doctor and really seeing, what's going on and if we can help that issue, and just trying to educate yourself on the specific areas that, the children's having the complaints for, and just really trying to, geez, I lost my train of thought. I keep doing that. I'm sorry. Get too.
Your question?
Advice to give parents their child needs chiropractic care. Hold on a second. Oh no. What would you say to a parent listening today who's curious but hesitant? That's the question. Okay. So what I would say is definitely understand your hesitancy. Not everybody is aware of chiropractic care and all the things that it can help with. I definitely would suggest going in and having that consult with the healthcare provider to discuss what is going on with the child and really just educating and learning more about that topic. And we're always here. And your spine, again, is something that is so important. And you only get one spine. And so it's really good to properly address the spine when you're young. And also that will transition into adult.
So why is it important to do it as a young individual?
Yeah. And that way, really, we can develop the spine. Oh my gosh, I cannot do this. I'm sorry. Say that again. I'm sorry. I'm so good at this.
So why is it important to have a child start when they're younger for chiropractic care than when they're older and have problems?
Yes. So that way we can really take that preventative approach, really address that at a younger age and prevent future injuries or spinal alignments or anything like that to occur in the future. We really want to make sure that the spine is developing properly. So that is so important to start at a younger age because maybe we can, see if the patient was going to deal with scoliosis, maybe we could have addressed that prior to them dealing with that. You name it.
So what would you tell a parent that is listening right now but is hesitant?
Sorry.
So what are some of the myths of chiropractic care that you would hear out there?
Okay. So some myths about chiropractic care. There's so many different myths about chiropractic care. Sometimes I've had people that say, because I don't hear this cracking noise, I'm not really getting adjusted. That's a myth that I've heard a lot.
What is that cracking?
So that cracking noise is the release of gases within that joint. Gases in that joint releasing. Geez, I said that weird.
Nitrogen gas.
Okay, let's redo that.
Okay, we're off. We're off today. It's not just you.
But the popping is something that's normal. Some people get really hesitant about wanting to get certain areas adjusted because they hear that sound. But again, we try to explain what that sound is and why we're doing what we're doing before we adjust patients so they can feel comfortable and understand, what is going to go on with this adjustment.
So it's just a gas bubble that gets popped is the noise, and then bones are not hitting each other. Okay.
Yeah, responses, but man,
Any last thoughts or comments that you want to share with our listeners?
Yeah, I definitely think, if it's something, again, where you're kind of on the fence about wanting to take your kid in to see a chiropractor, really just schedule that consult. Go in, have that in-depth conversation with the chiropractor just to see, what they can do, what chiropractic is all about, and how, we can help you essentially. So really, there's no harm in just going in and seeing what we can do.
One last question here will be, what if you had a bad experience with chiropractic care?
Yeah.
What would you say?
So, and that could be another myth that I've heard quite often that, I really believe that we hold ourselves to a clinical level of excellence. So every chiropractor is so different in their approach. So I necessarily can't speak on, if a patient came in and said that, what that chiropractor specifically did, I'm not for sure. But we try to strive for excellence as much as possible and trying to utilize the best techniques that we think are possible for that patient, depending on what they've been through and what everything looks like. We can really tailor our customized plan to them.
So, in other words, shop around. If you don't like one, go find another. And that's the same thing in the medical world. I mean, if you go to a doctor and they just ignore your symptoms or say, it's fine, you're going to have to live with it. Well, you don't like the answer, you're going to go shop around. And nowadays, you're going to have to shop around. So if you have a bad experience, I'd say go shop around, different techniques. I would say, just for me, my experience is, I could go to 20 different chiropractors, which I probably have maybe more, and everyone has their own way of doing things or different techniques. Yeah. Some of them I didn't like, some of them I loved. But yeah, it's just finding the right chiropractor. Yeah. The one that fits for you.
Some people are just so caring and concerning, and that is something that's always drawn me to a specific chiropractor and provider because they really will take the time to sit down and listen to your thoughts and what you have to say, and they let you really be a part of your care, essentially.
One last myth. It's the myth that a lot of people, and I think that's what scares a lot of people, is chiropractic care can paralyze me. You hear that?
I definitely get that hesitancy and that thought. However, if you're going to a skilled, qualified, certified chiropractor that absolutely knows what they're doing, and they take the time to go through a thorough history and do thorough exams and really figure out the root cause of the issue, where the issue is stemming from, that is something that we definitely should not happen.
Yeah. And what's the likelihood of that happening?
Very small percentage.
Yeah. So based on research, it's very small. And then when it happens, it's typically something that
It's predisposed.
Yeah. So thank you, Dr. Sharp, for sharing your insight and wisdom with us today. Appreciate you being on the show today. For sure, we're going to have you on different episodes on different topics. Listeners, if you've got different topics that you want to ask Dr. Sharp, just post it on there and we'll bring Dr. Sharp back and do an episode on whatever you guys want to know about. If you want to book an appointment with Dr. Sharp, or if you want to bring your kid to see Dr. Sharp, go ahead. You can call the number on the screen. That will direct it to Dr. Sharp, or follow us on Facebook, Instagram, TikTok, YouTube, and stay tuned for up-to-date wellness tips and family-centered care. This is the Healing Wellness Show. I'm Dr. Karim, and thank you for joining us today. And Dr. Sharp, why don't you share with us what special do you have right now for kids, pediatrics, or patients?
So for any of you listening to this podcast, we are offering a free pediatric posture scan. It's initially valued at $350, and this would be for new patients.
What does that scan entail?
So this scan, it would entail a posture analysis, and then we also would do a range of motion assessment to see how well it's moving in the areas that.
What's the posture analysis?
Yeah, so the posture analysis, we can figure out several things from this analysis. We can see, is there any pelvic tilt? Is there any anterior head carriage going on? Is there any, sorry, that is like the 5th time I've done that. And I ate lunch too, so I should be good.
So if they're off balance, right? If they're standing one side,
yes,
favoring one side more than the other, so we could prevent issues down the road. Okay, let's try that again. Dr. Sharp, why don't you share with us any specials that you're running in your clinic for kids or adolescents, or parents?
Yeah, so we're actually offering a free posture scan. It's usually a $350 value, and this would be for new patients. So what that looks like, our posture assessment, we take a few pictures of the patient that comes in. We can grab several different readings from this. So we can see if a patient is off balance, if one hip is sitting higher than the other. We can see, are they putting more pressure on one side and favoring one side? That can cause a lot of muscle imbalances to occur. That can affect the spine. We can also look to see if the neck is shunted forward or if the shoulders are rounded forward.
Technique.
Yep, exactly what we talked about earlier. So there's lots of different things that we will address and figure out with the posture assessment. It's a pretty cool feature. And then the other thing that we do is a range of motion assessment. So that is checking their range of motion again, seeing what areas are restricted and what areas are moving good. So we really want to address the restricted movements because again, with spinal misalignments, there are areas that are not moving. They're restricted. They're stuck. So we want to figure out where that's happening and get those areas moving more. So that's just another cool tool that we have that all encompasses and can add to the other tests that we do in it.
So how does someone receive that free scan or free posture scan? What do they have to do?
So you can call into our office and mention this video. You can follow us on, follow us on Facebook, Instagram, TikTok, and YouTube. I'm so sorry.
I'll ask you again. You got your thoughts together?
Get my thoughts together.
Okay. Dr. Sharp, how can someone get this free posture scan?
Yeah, so if you follow us on Facebook, Instagram, TikTok, and YouTube, and if you mention this podcast, we definitely can give you this free posture scan.
Well, thank you. That's really nice and kind of you. So folks, if you want that free posture scan with Dr. Sharp, go ahead. You can call that number on the screen, or like she said, follow us on Facebook, Instagram, TikTok, or YouTube to stay up to date. Dr. Sharp, thank you for that great offer today, and thank you for joining us today.